This child was admitted to the hospital because of a leaking embolism, and subsequently surgery was performed, and following the surgery she had a complete left-sided hemiplegia, which they expected her to get some recovery from. My goals for her are for increased strength in her lower extremity, and we're just increasing those goals in terms of strength and endurance. For dorsiflexion and plantar flexion, actively doing motions while seated and non-weight bearing is one reasonable way to get strengthening, but also doing those motions in a standing position require, first of all, greater strength, and it's a different sensory experience for her. We need to be able to utilize those motions in standing for our balance and then in walking. And I think using a child's body weight as a strengthening tool is great because that will be something she can carry with her. Toe walking is the ultimate use of your gastrocsoleus muscle. So it's a goal for me that she be able to do true toe walking and maintain it for a longer distance of time. I like to always look at her walking with no orthotics because I want to see what is automatically coming in when I'm not asking her to concentrate on anything. Are we getting some active dorsiflexion through the swing phase? And is she getting heel strike? And is that because she's extending her knee better, or is it because she is actually using her anterior tib to dorsiflex herself? In her DAFOs, I am looking for her to get a better aligned heel strike. Barefoot, she really gets her foot flat. Occasionally she will actually get a heel strike. But I want her to feel what it is to have a heel strike without the rest of her foot down, number one, and to feel some strength in that heel strike. She currently wears a Tami2 on her left-hand side, and I picked this orthotic because she had some active dorsiflexion that she was just beginning to bring into her gait cycle. And so I thought that this orthotic would give her nice feedback for what we wanted her dorsiflexors to do. When I start out a therapy session with this child, I like to see just how her sensory system's working, how much she can focus on a movement and change what it does. So I almost always start sessions by saying, just show me how you can move your foot this morning. And that's partially to get her focused on her foot and cognitively aware of what she can do, and also to just gauge how much of a change there is in terms of her ability to quickly and easily utilize muscle strength that she has. I spend time having her uninvolved side up on my leg because then I am gauging if she's taking her full weight on her involved side. She is not only strengthening her involved side by standing on it more than the other side, but she's also needing to balance on that foot because it's a slightly precarious position. Having her practice standing on her involved side independently is doing a few things for her. One is that she has some fears about how reliable her left side is in terms of just moving around the world, taking a step off a curb, walking on the grass. And I want her to increase her own confidence that that leg will be able to stabilize and hold her and support her, and that she can count on it, because that will encourage her to challenge herself more physically. And secondly, to give her brain and her body the feedback of what's balanced. So she has to retrain herself to understand that even though she may not feel that she's safe or in a balanced place, in reality she is. Skipping is a real motor planning challenge for most kids, and she really progressed beautifully because it was months before she could even skip on her uninvolved side. It felt very difficult for her to follow verbal directions, and I think really when she started getting it is when I started telling her just to sing while she was skipping, because that would divert her from thinking so cognitively about what she needed to do. She used to know how to skip. I knew that she could recapture those motor patterns. Sometimes I will hold her heel, not only to make sure that her hip is aligned where I want it to be, because her foot does tend to drift towards the midline, but also so that she feels a little more force than she is on her own able to generate at this point. I want that heel to feel the progression from her heel then to her toes, as opposed to a foot flat all at once.